The next objective is to try to explain to you briefly about the LipiFlow. Again, commercially, if the LipiFlow is successful, I have a commercial interest in it being a founder of the company. The breakthrough in LipiFlow came when I understood that heating the outside was the wrong way to go after we had done the warm compress data. So I knew that heating through was ineffective. And I knew that I had to raise the temperature immediately. And I also knew that it wasn't until you cut off blood supply to the area when you were expressing and attempting to expressing from the outside after using warm compresses with difficult people that you could really get results. So this device basically applies controlled heat to both the upper and lower conjunctival surfaces. So the heat is applied. If you just think of this as being a contact lens, a big scleral contact lens, and the surface that fits on the lid applies heat. That's really the essence of how it works. And it applies heat to both inner lens surfaces, and it applies pressure that is adequate to minimize the blood supply so that the blood doesn't wick away the heat. So you have a sealed system, and the pressure is varied from perhaps 2 psi to 6.5. So it's under that level that causes pain. And with most people, you can just do this without an anesthetic, unless they're very touchy, although topical anesthetic is recommended. So that's how it works. And the eyepiece is disposable. And on the outside, there's an air-driven bladder, and it has all this safety equipment. And the shaft that passes between the two lids is also heated, so that effectively begins to debride a lot of the excess material that accumulates on the lid margins. And in an FDA study, it was very effective. The number of glands tripled that were open, and it started to get up in the range. This would really be 8 because we didn't study the entire lid. So in this study, the mean number of glands began to approach that amount that was necessary to have relatively symptom-free eyes. Then we had tear breakup time, and tear breakup time went up. It never goes up as much as you want. Symptoms dropped in half, and a better way to look at that is about 2 out of 3 people at the end of 1 month following treatment, their symptom score was so low that they would not have been admitted into the study. So they really had significant benefit. And there are several sites that are doing it for about 1 year and 3 years. And symptoms were dramatically decreased at 1 month and at 24 months. And at 36 months, it started to creep up. MG function kept increasing with most people after 1 month and 12 months. And then after 24 months, it begins to taper down. And tear breakup time was, as I say, that is an enigma for many reasons. And that did not do as well. So as we're beginning to understand what we're talking about, now we can reflect back on will all dry eye respond?
Question, how many treatments did those patients receive?
Those patients received 1 solo single treatment. Yeah, that was the, thank you for asking the question. And the other point that I so far have missed is that perhaps one of the most important areas is for both the doctor and the patient to be educated, and then they have to learn how to manage expectations.